Heat illnesses, something that we are conscious of given the fact that we live in Fresno where it gets hot pretty good portion of the year in comparison to other places. And let's talk about the differences between these heat related illnesses. It's important to be able to identify at which stage or which illness your person that you're treating is in, so that way you can plan your treatment accordingly. Also important to note that on the assignment that you're doing as you're watching these videos or potentially doing afterwards where you're filling out along the way, you'll notice that it says heat related illnesses, pick which one. So this is where you'd be able to pick heat cramps, you'd be able to pick heat exhaustion, you'd be able to pick heat stroke, and fill out accordingly as long as you identify which one you're talking about. So heat cramps is kind of that first stage of heat related illnesses. And we've all probably experienced these at some point in our life. So they are the least severe, right? And the signal is that your body is just having difficulty adjusting to or processing the heat. When you're looking at a person who is having heat cramps, this is mostly going to present itself in muscle spasms, and that's usually going to be in the legs or the abdomen. Very rarely do we hear of muscle spasms happening in someone's arms. The reason is because these are typically the body parts that you're using, right? How do you give care to this person? We need to get them to a cool place, and we just need to allow them to rest. Okay, so we don't want to keep pushing it because this is your body's first response to telling you, hey, this is still manageable and you can overcome this and have a good time. In addition to rest, you're going to want to give that person carbohydrates. Carbohydrates and electrolytes. Electrolyte replenishment is very important. On this slide, it talks about sports drinks or fruit juice, and of course, water, right? My recommendation for backcountry would be to have Nuun tablets, Nuun. So they're these tablets that you put directly into water. They're very low in calorie, and they have a high amount of electrolytes in them. And so people tend to bounce back pretty big. You'll want to lightly stretch the muscles, gently massage the area, the muscles that are irritated, and it's not something that you have to do super strongly and hurt someone. It's just that you want to start kind of getting the blood flow moving to start circulating things. Do not give salt tablets. Salt tablets are far too concentrated, and so that can actually cause additional problems. So this is where you're going to stick to that electrolyte replenishment specifically. Once the cramps stop, the person can resume activity, okay? Make sure that you're monitoring them, making sure that they're not getting worse or that the heat cramps don't come back, but you'd be able to stay in the back country for that. Heat exhaustion is that next stage following heat cramps, okay? And so this can include heat stress or water and electrolyte loss. This is usually via precipitation or sweat, right? And then inadequate hydration. And it typically takes place when a person is exercising or overexerting themselves. What are we looking for beyond just these heat-related illnesses? Heat cramps. Sweating, excessive amounts of sweating, exhaustion, so beyond the point of just tired or usual exercise, but actually physically exhausted, mentally exhausted. Pale, sweaty, and typically there's flushed skin. A headache can be the result of this, nausea or vomiting. Thirst, so this person is typically thirsty, they haven't had enough water throughout the day, and there's a decreased amount of urine output, but when they do pee, it's this deep yellowish potent pee, okay? They can also become dizzy when they stand up too quickly, and they'll usually have some sort of elevated heart rate and respiratory rate. So when you're doing your total patient assessment, you'll see that. It's important to note that this slight elevated core temperature is not common. We don't really have a way of testing for that in the backcountry if you happen to carry a a thermometer that gives you some sort of insight. And if you're part of a group or some sort of recreational therapy or something like that, you might have that thermometer. But we're not to the point where actual core temperature is changing. In fact, your body is doing everything it can to keep you cool enough. And so this is, again, kind of a building block to worse things. So we haven't hit that point where our core temperature is different. So going over some of these things again on how to give care is to highlight some of these. So stopping, giving rest, preferably in a cool, shady place. Help this person replace these lost fluids and salt, but through electrolyte and carbohydrate solutions or replenishment. Nuun, N-U-U-N tablets is my go-to. Making sure that we're not giving these salt tablets. That's a common misconception. You can even buy them at REI, but we don't want to do that. Loosen and remove any excess clothing. And the reason for this is to try and allow the body to naturally cool itself, right? Not have that pressure. Wet down and fan the person to increase that rate. If the person's drowsy, absolutely allow them to sleep. Let their body relax and regenerate its energy and move past this, and allow the person to continue normal activity if they start to feel better. Recovery can take up to 24 hours, and you are going to want to be monitoring this person to make sure that they don't regress. Finally, the last stage here is heat stroke. This is very severe, can lead to death, and is absolutely a quick evacuation, right? So our previous two is as the person gets better, we can return back to activity. But with heat stroke, it's going to be a rapid evac or call for an evacuation from outside of your group. So this is a serious medical condition. And basically the body is producing heat faster than it can release that heat. And so the best thing that we can do for this patient is to help increase the speed in which we can get rid of that excess heat. This is where we have started to change our core temperature. The person is no longer in homeostasis. If our temperature goes up too high, lots of things in our body start to deteriorate. So hormone release, hydration, circulation of blood, all of these things, the health of our cells, everything starts to deteriorate and deteriorate quickly. A lot of times this person will present in some sort of disorientation and bizarre personality traits. They're not acting like themselves, so this is beyond just a physical effect that we're seeing. The skin can be hot and dry or moist. So it just depends. It's not really indicative. We're looking more at that disorientation or personality changes. Elevated rate of respiratory or elevated heart rate and respiratory rate. So again, body trying to circulate, get things moving, right? Trying to get nutrients to different parts of the body. The person will usually have a headache and they can have seizures. How to care. We need to rapidly cool this person. They need to get to a cool environment. If we can put them in water, fantastic. If we can pour water on them, if we can fan them, whatever you can think of that can help bring down their temperature, do it. Okay? Any sort of clothes that are retaining heat or heat retaining clothes, take them off, allow that person to cool. Like I said, if there is a water source, let's submerge that person, obviously not their face, right? We need to keep it safe. But if you don't, and you only have cold water in the form of drinking water or maybe a little creek or something, concentrate on kind of those big ticket parts of the body where a lot of heat escapes us. So our head and neck, we want to keep cool and use these cold packs on the armpits, groin, hands, and feet. Okay, so think of those warmer parts of your body that a lot of times we get sweaty or we feel a lot of heat release from normally. You need to monitor this person closely and stop your cooling efforts when the person comes back to a normal mental state. Okay, give cool water and sports drinks if and when the person is able to accept the drink. Absolutely, under no circumstances should you give someone a fever-reducing drug. This person does not have a fever because of any sort of infection happening in their body. They have a fever because their body is too hot. If you give them fever reducing drugs, we run the risk of having something interfere with the person's ability to cool down or our ability to know what's happening and if they're getting better or not. Okay? This person needs a healthcare provider. Even if they come back to, this is not a continue on. This is absolutely a evacuation situation because relapses are common. You'll get someone back to a normal mental state, and then there will be a likely chance that they will um, end up back in heat stroke.